We've definitely got eyes on Lions Sight First Eye Hospital. This is the Morning Mojo with Hermina, and we're thrilled to welcome two experts to the studio. Dr. Rizwana Peerbhoy, the CEO of Lions Sight First Eye Hospital, and Dr. Abhijit Rasal, a consultant pediatric ophthalmology and oculoplasty surgeon. Good morning. Welcome to Radio 44.
Good morning, Hermina. Thank you.
Good morning.
Thank you for joining us. So we're discussing glaucoma this morning, but first of all, we'd like to know from you a little bit about Lions Sight First Eye Hospital, the services offered. We believe you even have satellite clinics, so maybe you could tell us a little bit first about the hospital.
Thank you. Yes, the Lions Sight First Eye Hospital, where to us for the last 28 years, people's sight matters. And we are a comprehensive eye care hospital where we actually offer all manners of eye treatment, screening, and therapies with a comprehensive diagnostic setup. So it's a one-stop for any kind of eye ailment, whether it's a cataract, which happens to almost everyone once in their lives, or it's a retina problem and glaucoma, or problems with children such as things with squints, or aesthetics even, where people want to get rid of their eyeglasses and not wear glasses anymore. So we have a comprehensive setup for almost everything, backed up by diagnostic services, because compassion, care, and excellence at what we do in an equitable state is what we offer. So this is what the Lions Sight First Eye Hospital is about. And of course, today with people's lifestyles, we know that people can't always reach the main hospital. So we have actually developed satellite centers at logical places all over. We have one at the Village Market, one at Southfield, one in the CBD, and also one at the Dinesh Chandaria Doctors Plaza in MP Shah, so that patients can actually go wherever it's easy and convenient. And to make it even more convenient, we are open 7 days a week at the Village Market and at the Southfield Mall. So people who might have a problem or who are unable to go due to work pressures can actually take Sunday and go and see a doctor and be treated, or at least get the first interpretation of anything that they have.
Okay, and why are regular eye checkups important?
There are several reasons. You know, our lifestyles today, climate change, but most importantly, the use of technology. We're using a lot more technology than we used to before, and this obviously puts a lot of pressure on the eyes. So regular eye checkups are very important. In fact, right from when children start to go to school, because sometimes children have basic conditions, it's very important even just before they go to school for parents to check whether they've got perfect vision or whether there's anything that needs to be watched as they develop. So eye checks are getting more and more important, especially with the increased use of technology much earlier on in life.
Okay, and Dr. Russell, what is glaucoma and why is it considered a silent disease?
Okay, that's a good question. Okay, glaucoma in medical field, what it means is increase in intraocular pressure. So just like our blood pressure, which is increase in blood pressure, which we call it as hypertension. So increase in intraocular. Ocular means eye. Increase in pressure within the eye itself, we call it as a glaucoma. So what you need to understand, anything which is a closed space, it has its own volume. If anything has a volume, it will always have its pressure. So eyeball is a closed structure which is connected with a nerve to the brain. So eyeball acts like a camera. It takes the picture, it sends the photo to the brain. The person standing in front of you is your mother or father, knows by the brain. So it is a matching of the vision of pictures taken by the eye, which helps us to know whether the person who is standing in front of you. So in increase intraocular pressure, what you need to understand, there is always one production system and one drainage system. If the flow is balanced, the pressures are not increased. Like in youngsters, the pressures are still okay. But as you start getting old, the drainage affects, so the pressure of the eye increases.
Okay, so there's a lot more to discuss about glaucoma and how it impacts vision as well. So we will take a short break, but stay tuned. Don't miss this opportunity to gain valuable insights into eye health care. Stay with Radio 44. This Thursday morning, you're with Hermina on Radio 44, and in the studio with me is Dr. Rizwana Peerbhoy, CEO of Lions Sight First Eye Hospital, and Dr. Abhijit Rasal, a consultant pediatric ophthalmology and oculoplasty surgeon. We've been discussing glaucoma, so let's just dive back into that conversation. Dr. Rasal, how does glaucoma impact vision over time?
Okay, so what you need to, as I said, the eyeball as a nerve which communicates with the brain, and why it is called as a silent disease. Let me talk on that first. So like if anybody has an eye flu, so what does the patient complains? As soon as he gets eye flu, he complains of redness, tearing, discharge and diminution of vision. So he will come to us immediately next day that, doctor, I'm having these problems, kindly sort me out. Supposingly someone is having a COVID, what will have? He will have fever, he will have cough, he will have headache, he will have body ache. Now someone is having increased blood pressure, you will not come to know. Someone is having high blood sugars, you will not come to know. So same is the case with the glaucoma. If you have increased intraocular pressure, you will not come to know, because the symptoms of glaucoma are very late in presentation. And now increased pressure is directly putting the pressure on the nerve, because there is only one outgoing channel, which is a nerve, and rest of the eyeball is completely packed by walls, you can say, which is called as a scleral wall, and you have a cornea in the front. So the pressure, whatever is increased in the eye, has a directly impact on the only outgoing structure, which is nerve. So we know that nerve damage, whatever happens, cannot be recovered completely. So if you have 100% of your nerve utilization at the age of 20, you start getting glaucoma by age of 40, and the nerve damage is supposedly like 2 to 3% per year. So maybe in 10 years you're losing 30%, again 10 years you're losing 30%. So that nerve damage, whatever occurs, does not recover. So that is why the diagnosis becomes very late. If the diagnosis is late, then we call it as a silent disease.
Okay, and who is at most risk of developing glaucoma?
Okay, now the first important is that glaucoma can occur from to any patient, right from the childhood to elderly. We have patients of having congenital glaucoma who have glaucoma at birth itself. So there is one strata of the patients who have an early glaucoma, we call it as congenital or by birth, or juvenile by till the age of 10 to 14 years. The other set of patients usually comes after 40 years of age. Just like our increased blood pressure, the pressure of the eye starts increasing. So after 40, you start having the chances of getting glaucoma. If you have a family history of glaucoma, you're more predisposed to get glaucoma.
Okay, and how is it diagnosed, and how often should one even get tested?
Okay, as I said, like the blood pressure in our body is diagnosed by checking the blood pressure. So the intraocular pressure there are ways to measure the intraocular pressure. So the first thing which we have to do is to measure the pressure of the eye. Then the examination of the optic nerve. So examination of the optic nerve can be direct by a simple normal routine fundoscopy. If you feel that the patient is suspicious of glaucoma, then we have a array of diagnostic investigations. We do like optical CT, just like a CT scan of the head, it's like a CT scan of the eye. Then we have a RNFL analysis. Then also we have HVF. So glaucoma affects your field more than your vision. You can have a good vision, but still your 90% of the eye can be damaged. So that is why it is also one of the cause for silent disease.
So then when should somebody think I need to go and get tested? Is it something that you need to do often, or is there some symptoms that they're developing, or they have issues with vision and they need to come and see somebody?
I think with the kind of lifestyle that we're going to, anybody over the age of 40 should at least have their eyes examined once a year. However, if for the kind of symptoms that Dr. Abhijit has mentioned, things like redness, frequent tearing, headaches, then it is important that, besides just looking at it as, something that's dry eyes or something that will go away, then one should attempt to get a screening done so that you rule out anything that's developing in the interior of the eye.
Okay, so we will take a short break, but we're in the studio with Dr. Rizwana Peerbhoy and Dr. Abhijit Rasal. We will be discussing more about treatment options and also lifestyle changes which can aid in managing and preventing glaucoma. Keep it Radio 44. If you're just tuning in, we're having an enlightening discussion on glaucoma with our esteemed guests in the studio, Dr. Rizwana Peerbhoy from Lions Sight First Eye Hospital and Dr. Abhijit Rasal, who's a consultant pediatric ophthalmology and oculoplasty surgeon. We've discussed what glaucoma is, its symptoms, but maybe now we need to discuss lifestyle changes in aiding in managing and also preventing glaucoma. Doctor?
Okay, so Harmeena, so like lifestyle changes are important for every disease. So what we have found out, or what the research by American Academy of Ophthalmology has told, that having a dark green leafy vegetable which contains high amount of nitrates, which are important to vasodilate, and they give more blood supply to the nerve, which improves the nerve health. So dark green leafy vegetables, diet rich in omega-3 fatty acids, reduce alcohol consumption, reduce caffeine. This alcohol and caffeine, they cause vasoconstriction, reduces the blood supply to the nerve, so it can affect the nerve health. So these lifestyle changes, along with that, what you can say, doing an aerobic exercise. So aerobic exercise for 30 minutes can have a positive effect on control of glaucoma. Then also what you can say, yoga. Yoga also has a positive effect. Swimming also has a positive effect on glaucoma.
Okay.
Then also you see a sleeping position, how you're sleeping. So what the research has found out, if you're sleeping upside in the supine position and you're coming from sitting to supine position, the pressure increases by 2 mm of Hg normally. Because when you're sleeping with the head low, you will have direct pressure on the eyes. Okay, but in patients who are suspicious to have glaucoma, the increase in pressure is more. Like normally the pressure in the eye should be between 10 to 20 mm of mercury. So if from sitting to supine position in normal it is increasing by 2, in glaucomatous suspect patients it is increasing by 4. Even a change in position also works. Then obstructive sleep apnea, which is also like patients who are snoring more during sleep, they're also more predisposed to having glaucoma.
And off air we were discussing, and you mentioned how high intensity workouts, people who are already predisposed to glaucoma and they're undergoing high intensity workouts, there is an issue there. Please enlighten us.
Yes, what research has found is that if people are predisposed to glaucoma or have any level of glaucoma, high intensity workouts for 2 hours, etc., will have a negative effect, because it doesn't tend to send enough oxygen supply or to keep the oxygenation level good enough to the nerves to be able to keep the pressures low. So this is something that has been identified. So it's always a good practice, if a person who is going to embark on high intensity workouts, to be pre-screened so that they can then be guided on what level of intensity they can
like just I said, aerobic exercise means exercise which gives good amount of oxygen to the nerve. When you do high intensity exercise, there are more release of oxygen radicals, which consumes oxygen itself more. So high intensity workouts, they release more, like we are taking green teas because it gives you more oxidized articles so that it can consume that. So high intensity workout reverses the benefit of aerobic exercise.
That's interesting. I think a lot of people don't know about this. You would never think that the amount of exercise and the way I exercise is going to have an impact on my sight. So is vision loss from glaucoma reversible, and how does it relate to other eye ailments?
Well, vision loss from glaucoma is manageable, but at this stage not really reversible. But of course research is ongoing and we're always hopeful that it will. But nerve damage essentially is permanent at this stage. There are treatments available, which Dr. Abhijit will tell you more about, which can help to prevent the progression of the disease.
Okay, Dr. Abhijit, the treatments, what are they?
Okay, now once you have, just like blood pressure and blood sugar, we always tell them if the patient is pre-diabetic, pre-hypertensive, just like a stage is called as a pre-glaucomatous. If you are pre-glaucomatous or suspicious, we tell them to start with your lifestyle modifications, which you are saying. If that keeps your nerves and the pressures under check, very fine. If they are exceeding like 30, which is called as beyond ocular hypertension, and then we start the treatment. So as I said, the eyeball has there is no static fluid, there is a continuous flow of the fluid, which is one is the production and other is the drainage. So in treatment options we have the drugs which reduce the production of the fluid. The second is the drugs which increase the drainage of the fluid. So you can start with one drug therapy, two drug therapy, three drug therapy, or four drug or maximal drug therapies. If they are not, sometimes, but if glaucoma once diagnosed is a lifelong condition, just like hypertension and diabetes, you have to keep taking medications to control the diabetes. So patient compliance is not that good. So we also have an option of laser OPD based laser surgery, where the trabecular meshwork, the drainage part of the fluid has a meshwork, just like our washroom has a mesh, and then from the mesh there is a tube connecting going to the drain. So our eyes also has a meshwork which drains the fluid, that is called as the trabecular meshwork, and from their tube there is a Schlemm's canal. So what we have is a selective laser trabeculoplasty. So what it does multiple openings, larger opening, so that the drainage of the fluid is increased. So there are drugs which decrease production, and there are laser procedures which increase the drainage.
Okay, so we've discussed glaucoma. We will come back in a few minutes and discuss a little bit more about Lions Sight First Eye Hospital and what other treatments it offers.
Thank you.
This Thursday morning, Hermina with you on the Morning Mojo on Radio 44, and we've been discussing eye healthcare with Dr. Rizwana Peerbhoy from Lions Sight First Eye Hospital and Dr. Abhijit Rasal, who's a consultant pediatric ophthalmology and oculoplasty surgeon. So we've been discussing glaucoma, but I wanted to discuss a little bit more about Lions Sight First Eye Hospital. What other services do you offer?
Okay, so as we've mentioned, besides all the different treatments for eyes, whether it's retina, cataract, or glaucoma, we also offer a comprehensive diabetes clinic. What we did identify was that when people were coming to get their eyes checked, a lot of it was because of people living with diabetes. Persons living with diabetes are very vulnerable to glaucoma and retina-related diseases, and these are, of course, affecting the nerve and therefore are not reversible. So we have a comprehensive center where we are managing foot and wound, and diabetes gives rise to a lot of feet and issues with the feet, with wounds that develop, which result in amputation. So we have come up with a lot of treatment and therapies, managed to save a lot of amputations. So as a hospital, that is one critical piece. The other critical piece is eyes and the ears are the two largest perceiving and receptive organs that the brain depends on for making its messaging, for doing everything that it does. So hearing as well with technology is tending to get affected a lot more. So we have a comprehensive diagnostic hearing center which actually tells you all the way up to the brain what part of the brain is losing its hearing and perception, as it were.
Okay, and what about your doctors? Are they all resident doctors?
Yes, all our doctors are resident. They're here permanently, and so they're always available. And as far and wide as possible, we have multidisciplinary, so some of them are combined doctors. So they're able to do more than one discipline in terms of eye health or in terms of dental or diabetes health. So they're always here, and this is something that's very important for us because we want to be at scale, sustainable, and available to our patients.
So you mentioned the satellite clinics earlier on. You said you have some at Village Market, Empishar Hospital, at the Southfield Mall, Embakasi, in Town Centre as well. Where else can we expect some more satellite clinics from Lions Sight First Eye Hospital?
Okay, we're also in Nyeri, but at the moment you will soon be seeing us in Isli, very close to the big mall that everyone talks about, and also opening a large, very comprehensive hospital in Kisumu, hopefully by the end of this year. this hospital is actually being developed purely just like the Lions main hospital in Loresho to cater for Western Kenya and the Lake Basin region, because it's very difficult for patients to access regular treatment and care and come to Nairobi all the time.
Absolutely.
So this is what you can expect from the hospital.
Okay, any parting thoughts from you, Dr. Rasal?
No, thank you. But only just to add, like Kisumu will be more like a referral center itself,
Okay.
not like a satellite clinic. Kisumu,
Right.
we cannot call it as
Fully fledged, more like
full-fledged.
Okay.
Yeah.
All right. Thank you so much. That wraps up our enlightening discussion on glaucoma and eye health care. A huge thank you to you, Dr. Rizwana and Dr. Abhijit Rasal, for sharing your valuable thoughts and insights with us today. Your expertise has definitely shed a lot of light on such an important topic, and we truly appreciate your time and knowledge. Thank you for joining us at Radio 44.
Thank you,
Thank you.
Harmeena.